For the first time in 2023, we're catching up with the Shadow Assistant Minister for Regional Development and member for Mallee, Anne Webster, but you've got more to that title as well, Anne.
Yes, and in fact, the regional development has gone to Darren Chester, and I have taken on regional health, which I'm very excited about.
Yeah, you've done a lot of work in that regional development area, but you did express continuously when we spoke with you this passion and concern about regional health as well, simply because there's so much need in regional Australia.
Well, the thing is, if you don't have health care, you don't get workers because they're not going to come if they haven't got a doctor or if there are no health services available. So it's essential that people can access timely health care. And at the moment, people in Mallee in particular, but also many other regional centres, cannot access GPs. You know, there is no appointment available if you're a new patient, and often wait times up to 8 weeks. So it is, we're in a dire situation. Further than that, 58% of Mallee GPs are over the age of 55 years. So, you know, if we think we're in crisis now, we're heading into the catastrophic zone without serious change.
And we covered this issue quite a lot across all of our broadcast areas in South Australia, Victoria and New South Wales about the shortage of doctors. And there was a summit called, I think, by the GP representative bodies during last year. But, you know, we could talk about solutions in the next election, but people need some solutions now. What are you putting forward into how we can fix this in the immediate term?
Yeah, I am holding a summit myself. I've invited all the peak bodies. I'm inviting GPs, nurses, nurse practitioners, allied health and pharmacists who work in regional communities to come together and to share their experiences, their stories, their concerns with the peak bodies. So we have the AMA, we have RSEGP, we have ACRM, we have RDA, we have RWA. I know there are a whole bunch of acronyms, but the fact is that these are the peak bodies. Most of the presidents and CEOs are coming because they understand if they don't hear from the horse's mouth, so to speak, it's going to be very difficult to change policy.
And when it comes to, I guess, when people think of immediate solutions, some might think of opening up the visa opportunities for doctors to come and practice in Australia. But why is that not a silver bullet here?
Well, let's face it, there is no silver bullet. I just have to say, if you can hear, I am at the Jamala Zoo in Canberra. My husband and I have our grandchildren here, and the lions are going off their tree. Literally. So that's what, it's not my stomach, it is actually lions.
We're glad you mentioned that because we're used to reporting, say, from the sale yards at Wagga Wagga when there's cows going off in the background. We haven't had lions going off in the back of an interview before.
No, and they're very loud. So what can I say? So, look, the summit itself is incredibly important. I want to bring the peak bodies together to hear from locals. Let's flip the model, if you like, of summits. This is not about the peaks coming and telling us, you know, what we should be doing. It's for them to actually hear and to come up collaboratively with solutions, both the short term, obviously, for the critical, urgent situations that we face, and visas are part of that. But it's also long term for education pathways for regional students, where we know that if regional students are studying to do medicine, they are far more likely, I believe it's around 60% more likely to stay in the regions. And that's what we're needing. We've got some very smart, bright young students who are heading into Year 12 this year. You know, the idea is that they would have a pathway at an undergrad level and a postgrad level to be able to complete their medical training.
Yep, that sounds like a positive initiative for regional communities and families. When it comes to an also complex area of aged care, you've expressed some concern over the Christmas break about a couple of facilities in your electorate of Mallee where if the rules are applied in a sort of one-size-fits-all approach, some of these, well, what does their future look like?
It's not pretty. I've had another one contact me this week, a very strong, larger one, which is even more concerning. Like, we know that the viability of smaller ones is seriously at risk particularly with the new policies that have come out of the Royal Commission. Nobody is saying that the Royal Commission findings and recommendations shouldn't be adhered to. Everybody wants top care for their parents and their grandparents. But the reality is that in smaller towns, smaller facilities cannot, get RNs, registered nurses, 24/7, and they don't have access to agency nursing because they're in the cities. And the fact is that they've been able to manage with personal carers and with enrolled nurses and do a very good job. On the new star rating, they are doing very well. So there is no flexibility in Labor's approach to this, which is deeply concerning. I have raised the issue with both the Minister for Aged Care, Annika Wells, and to Mark Butler. And I am deeply concerned. As I said, this is a larger one that has contacted me this week, and they have said that they'll be heading into a board meeting this week, and it looks like they will have to close. This is devastating. It will be absolutely devastating for people who live in regional centres, and it cannot go on. We've just got to have more flexibility in the funding models themselves, and also in what is expected at smaller aged care facilities, where people are very happy.
Well, it does seem that if there's inflexibility in the model being applied by the federal government, shouldn't it be bringing some funding to the table to make, the staffing, you mentioned the RN shortage, make it easier to get someone recruited to that area?
Look, that is absolutely one of the solutions that should be applied, but the other one is getting staff out to our regional centres. And here we go again, there's a hole in the bucket. If there isn't healthcare available, if we don't have education, not that I'm going to go down education pathway at the moment, that's Darren Chester's baby, but we need to have solutions for families so that they feel confident in coming to regional centres. I've had people who in their 50s say to me, I'm facing the fact that in the next 10 years I may have to make the choice to leave because the healthcare system is not going to meet the needs of the number of older people who live in the town. And then you've got young families with young children, of course, who want to ensure that their children have the best care possible as well. So we are in a dire situation, and we need to see solutions, and that's why I'm bringing the summit together on the 1st and 2nd of March.
The social fabric possibly gets torn somewhat there if you have potentially an older person moving for health choices. Grandma or grandpa moves away and they can't help in the family context or even volunteering in the local community. Oh,
absolutely. Our older residents who live in our towns provide so much of the voluntary assistance across every sector of life, whether it's education, whether it's Meals on Wheels, whether, just whatever it might be, patient transport. There are so many areas where we need our older residents to have optimal care, healthcare, and be able to operate in and provide, continue to invest in their local communities. We certainly don't need all our grandparents and older residents moving to larger cities, which are, for families, incredibly difficult for them to travel the distance that is required. So our thin markets are a key source of problem. Even if the funding were found for our smaller aged care facilities, I'm deeply concerned that we don't have the nursing training models that allow people to stay in rural communities and to train as they're working, potentially as a PC, then an EN, then an RN in the facility itself. And that would resolve a lot of our workforce issues.
Well, Anne, just before you go, how does it compare the lions roaring there at the zoo versus the dispatch box in Canberra? Which one's more fearful to face?
I don't know why the line is so bad, but I hardly caught a word of that. I apologise.
Oh, the mobile line might be bad, but the lions roaring in the background, which is harder to face? The lions there roaring at you or the dispatch box in Canberra?
Yes, these lions, I've got to say, if people haven't been to Jamala in Canberra, they really need to come. And we have a history now of bringing our grandchildren when they reach the age of 7, 2 at a time, to Jamala, and for them to experience this amazing zoo. It really is it's an icon, I think, in Australia.
We'll let you get back to that wonderful family experience. Anne Webster, member for Mallee, thanks so much for joining us today.
Thanks, Ricky. Appreciate it.